Good evening, everyone. My name is Ken Tabor, and I am the chairman of the Phelps Community Board. I want to welcome you this evening to the next installment of our new Insiders series, showcasing exciting developments underway here at Phelps. We are making many significant investments that will allow our exceptional caregiving team to do even more for the patients we serve right here at Phelps. Tonight, we're focused on our Maternal Child Health Unit. You'll hear in a few minutes about the work underway at Phelps that will be transforming our Maternal Child Health Unit and what this will mean for our hospital and our community. This is just one of the many exciting projects underway at Phelps right now. This brief film will give you some of the highlights. Take a look as Phelps leaders look forward.
Phelps has always been a community hospital that really does big things. When I think about what makes me proud to be at Phelps, hands down, it's the staff. It's the whole team. Whether they're providing direct care or indirect patient care, they do it every day with kindness. Their resiliency shows through. They really are a remarkable group of people.
It's almost like family, and I think that we've been able to really build and retain a small community hospital culture. That culture then trickles down to the patient, so I think the patient experiences that also. So I'm very proud of the staff for what they do every day. The experience of the nursing staff during COVID was certainly one that no one had ever had any experience with in the past. At one point in time, every patient in the hospital was COVID positive. Early on in the pandemic, we submitted a document to the American Nurses Credentialing Center. That organization deems hospitals magnet hospitals, and magnet status it's really the epitome of nursing excellence. We were deemed to be a magnet hospital, or initial designation, in October of 2020. We had a very generous donor who created an endowed scholarship for nursing, and it really is something that will help us to support our staff and to fill our nursing positions. So I think that that was really another highlight of last year.
We work together as an incredible team, and I think that's a good foundation for the hospital to have. I think, again, that's the best way to offer the latest, the best, and the safest care to our patients. It's coordinated care. We work together, the whole team. We're very proud of our residency programs here at the hospital. We've had our family medicine residency program here for more than 10 years. We bring in bright, wonderful, engaged, knowledgeable residents. As of this year, we actually now have added surgical residents, and we right now have 4 surgical residents rotating through our surgical program, and it's been incredibly successful. It makes the facility of the hospital more academic, there's more learning going on, it raises the bar. It's wonderful. It really raises the level of the hospital. When we plan our strategy on how to either grow our services or add new services, we know that part of that strategy is not only bringing in the right person, the right providers, but bringing in the right technology so the physician has the tools and equipment they need to offer, the most advanced technology, the safest and best care to our community, our patients.
We have 4 major projects going on right now at the hospital, large construction projects that represent years and years of planning. So right now we're focusing on 3 major clinical strategies. One is neuroscience, another is cancer, and lastly we have surgical services. Another project that we have is what we're calling right now the Center for Advanced Procedures, which is an interventional radiology suite that will focus on really advanced neuro-interventional care. We're building neurosciences at Phelps. We are an advanced stroke center. In fact, we're working towards becoming a Joint Commission thrombectomy-capable center, which is only the 2nd in Westchester County. We will be a Joint Commission thrombectomy-capable center within the next year, and that will be probably the biggest clinical advancement that Phelps has seen in its history. People used to want to go to the city in order to get advanced care, tertiary care, And now they don't have to do that anymore. They could stay close to home and get advanced care right here in Sleepy Hollow. The complexity of care I expect to just continue to increase. One of our clinical pillars and focus areas is mother-baby and maternal child health. And we've invested an incredible amount into rebuilding our entire inpatient maternal child health program. Right now, one of the construction projects we're working on is the mother-baby unit. Phelps will be a premium place to deliver your child. We're very excited because it's so unique, it's so beautiful. There's nowhere else you could have a baby while looking over the beautiful Hudson River. So in some ways, the construction projects represent the end of the planning of our strategy and the beginning of the future.
I think we're very blessed to have a community and donors that are so interested and engaged and generous to the hospital and to the staff. You know, during the last 18 months, during the pandemic and afterwards, it really highlighted that support. It's hard to express the gratitude you have for everybody involved in this endeavor. And on behalf of the hospital, I can't say how grateful I am and how proud I am to work at Phelps.
Hi, everybody. I'm Eileen Egan, the Executive Director at Phelps Hospital, and joining me is Eve Jerome, our Nursing Director of Maternal Child Health. Hello. You've heard before, you've seen that there's so much construction going on here at Phelps. One of the major areas under construction is maternal child health, I'm happy to say. We are renovating and transforming all 3 units on our maternal child health unit: postpartum, labor and delivery, and our nursery and NICU. You're going to be hearing all about this from our panel of experts in a little while, but we thought that before you hear from the panel, you might want a sneak preview of the progress we've made so far on maternal child health. So come.
So, as you can see, we have a lot done since the last time we were here.
Absolutely. The flooring.
So we have the flooring, the lighting is so beautiful. All the rooms are almost there. So what we are hoping to be able to show you is how large the rooms are. They are very bright. It's such a beautiful, welcoming area.
And many of the patient rooms are facing the Hudson River, so we provide the best view possible for mothers, babies, and the new families. We think that's going to be a real people pleaser.
Absolutely. Right? And the nursing staff is looking forward to this new, beautiful floor. So let's just
so
go
spacious. Yeah, let's go into one of the rooms.
So I think we have one of the nicest rooms down there, especially it has such a beautiful view. So let's go to that and we'll look at it.
Sounds great. Sounds great.
So again, this is the view, and we really want you to have an idea of how beautiful this view is. So
magnificent.
It's so beautiful. Look at the water. So that's one of those that
the room is very, very spacious. There's a workstation for the nurses where they can put their computer. And the bed would go against this wall.
Cool.
All the oxygen gases, vacuum outlets. I can't imagine. Can you imagine the family start in these surroundings in this room? It's so beautiful.
Such a beautiful
bright.
welcoming. Yeah.
Yeah.
And then over here is where we're gonna have all the stuff. Hopefully, I think by the time they're done, the colors will be very vibrant. By the time they put the shade on the window, so that if the patient wants to have a soothing time, so it will be well done.
Yeah. And the workstation there with all the equipment and supplies.
And the supplies, everything's easy access to the nursing station. Everything that the patient needs will be here. We also have a closet here. So the patient will be in such a calm, beautiful surrounding.
Yeah, it looks beautiful. I'm so anxious for our mothers to be and our fathers to be here. Yes. And now we'll hand it over to our panel of experts to talk more about the unit and some of the other plans that we have for maternal child health.
Thank you.
Hi, everyone. Looks like our panelists are starting to join us. What a great video. It's nice to be able to see the space before we start talking about it. And it's looking great. Thanks for the tour. Eileen and Eve. And we'll get to hear more from Eve during this panel. So welcome, everybody. I'm Robin Scotlock. I'll be our moderator tonight. I'm a family medicine doctor. I am the medical director for our outpatient medicine and medicine subspecialties here in this northern subregion of Northwell. And in my role, I get to work with our OB-GYN providers and staff, which is a big pleasure. You know, as a family medicine doctor, I trained in OB, but I'll tell you, it was one of the most stressful things I ever did. Catching babies is not for the faint of heart. And I was glad to finally give that to these amazing professionals who we'll be speaking with tonight. So I'd like to introduce each one of them so you can see who's on the panel and who will be speaking to us. Let's go ahead and start with Dr. DiStefano. Would you introduce yourself to the group?
Sure. Hi, everybody. I'm Serena DiStefano. I'm an obstetrician gynecologist. I'm happy to say I've been practicing at Phelps since 1985. I've been here for a long, long time doing general OB/GYN. I now I have a practice that is within the hospital as part of Northwell Health Physician Practice. And I also function as the safety officer, which is the obstetrician covering the labor and delivery unit. And we staff it 24 hours a day. Thanks.
Thanks, Dr. DiStefano. You know, a fun note is Dr. DiStefano actually delivered 3 of her own 4 children here at Phelps. And because Phelps is like a second home to her after working here since 1985, she likes to tell the joke that they were actually 3 home births being here at Phelps. It's lovely. Our next panelist I want to introduce is Kathy Heron, one of our wonderful midwives. Kathy, would you introduce yourself?
Sure, thanks. Hi, I'm Kathy Heron. I'm a midwife, and I've been a midwife for 35 years, although I don't feel old enough to say that. And I've been at Phelps for 25 of those years this year. Our office where we see patients is in Harrison in Lower Westchester, and we deliver babies, of course, at Phelps.
Thanks, Kathy. You know, one of the things that I think is so special about Kathy is 22 years ago, she started a midwifery group here in Westchester called Full Circle. And it's been a premier midwifery group that eventually, as she noted, joined Northwell Health a few years ago. So a terrific accomplishment, and she's really a towering figure of midwifery here in our community. I also would like to now introduce our next panelist, Eve Latour-Jerome. Would you say hi and introduce yourself?
Hello, everyone. My name is Eve Latour-Jerome. I am the director for Maternal Child Health here at Phelps. I studied here in 2018, but my journey started I've been a nurse for 40 years, and I've been an OB for 35 years, since my daughter is 36. So once my daughter was born, I really fell in love with this whole practice. So here I am. So I am currently the director here at Phelps, and I look forward to truly, with all this construction we're gonna have, I'm looking forward to see how it's gonna be. Thank you.
Thank you, Eve. One thing about Eve is since 2000, year 2000, she does a number of medical mission work. In fact, she's gone to many different countries, Philippines, India, Haiti, Dominican Republic, where she serves the people, usually in a surgical type capacity, doing women's health very frequently. So in her spare time, she continues her work outside of Phelps. So thanks for everything you do for us and for the world at large.
Thank you.
We have a 4th panelist who is scheduled tonight, Mazen Khalife. He's the chair of our Department of Pediatrics and our chief of neonatology and newborn medicine. And he is working tonight. He's on call. And you know, when you're on call, you never know what's going to happen. And he was called to attend a C-section, and that's what he's doing right now. So he's giving medical care, and we're hoping that he can join us during this panel. He might just pop up. and that would be wonderful. And if he doesn't, we'll miss him, and we'll hear more from him at some other time. All right, well, let's, I want this discussion to be open with our audience as well. So as those of you who are joining us can see, there is a way for you to ask questions. And I want this to be interactive. So please, as we're talking during this session, if something pops into your head, you have a burning question, you want some clarification, please go ahead and type a question into the browser, and we'd be delighted to answer that. Well, to kick things off, why don't we talk to you, Kathy, for a minute? You know, as a midwife here for so many years, you have a very unique practice here at Phelps that I don't think really any hospital in the region has, which we're so lucky to have. My question is, with all these big changes we're making to this mother or baby ward, all this money we're spending, the whole goal is to improve patient care and patient outcomes and patient experience. So tell me, from the perspective of a midwife, how are these renovations going to benefit patient care?
Sure. Well, first, in case there's some people on the panel that aren't familiar with what a midwife does, I'll just share that we do OBGYN care for low-risk, healthy women with an emphasis on what we like to call low-tech, high-touch care. And so, although we do jump in, of course, to provide interventions if necessary, many people come to us hoping to have as natural a birth as possible. And so we, of course, have a lot of tools that we can help them with. But the thing that I am most excited about with the renovations is that there is going to be a labor tub in every room. The reason that this is so exciting is that laboring in water seems to be some kind of magic. Women love it, and it reduces the need for pain medication. It decreases their anxiety. It can speed up labor, and it also decreases the need for cesareans. So that really impacts on patient care. And when I first started our practice at Phelps, there weren't any tubs. And people used to call and ask if there were. And our biggest competitor to the North Hudson Valley Hospital, they had tubs in every room at the time. So we were losing patients to them. And so I went to administration and suggested that we get a tub. And we were able to get one to try. And it was so successful that we ended up being able to get 3 great built-in jacuzzis. But unfortunately, one of the rooms we have currently is too small to build one. So our patients are told that they do have a slight chance, 1 out of 4, of getting a room without a tub. And so in the new renovations, there's going to be one in every room, and that will be a great relief to our patients, and more people will be able to take advantage. And that'll be great. And the other thing that I'm really excited about is that we also have wireless waterproof monitors currently, which I'm hoping that we will be able to get for every room now. And that will enable people who need to be on the fetal monitor, for instance, they're being induced or they've had a previous cesarean, and those are reasons to be on the monitor. They can get into the tub and still be monitored. We can still hear the baby's heart, it's waterproof, and they can also walk around the room. They don't have to be tied to the bed in any way. So this is really going to be great.
That's awesome. I'm so curious about these tubs. You know, a lot of people probably haven't seen them. Describe like what it looks like. How does a woman get in and out, and what parts of labor would you use that in?
So the tub looks like a nice built-in jacuzzi that you might have at a spa, or maybe even in your house if you've got a really big bathroom with nice tile around it. I haven't seen the plans for the new ones, but I'm assuming they will be every bit as wonderful. And we have a little stool, and they can just step over the edge to get in the tub, the same as you would get in your tub at home. We suggest that people get in the tub when they start to get to the point of labor where they're really uncomfortable and are looking for something to make them feel better. Something about the warm water and very relaxing, and they can stay in all the way through their labor if they care to. So we usually wait until they're they're pretty far along and getting uncomfortable, and then we suggest they get in.
Have the partners ever asked to join them in the tub?
We have had that request. We usually discourage it, trying to keep it as clean as possible.
That's awesome. It sounds really great for the women who are laboring here. Thanks.
Yes.
Well, Eve, you run a fantastic floor there, and we have really great staff, nurses who have been there for years. I bet they're looking forward to this remodel. I'm sure it's going to change the way that they work. What are some of the things that you see from your staff, or what you've heard about how they think these changes are going to lead to better outcomes for patients based on the work streams they do?
Right. Well, absolutely. First of all, with this renovation, all the rooms will be much bigger than what we currently have, which now will create this environment of safety. We're not going to have so many instruments and stuff all over the place. So the patient will have it's much more comfortable at ease at home. And the nursing staff, what they're looking forward to is the fact that we're going to have state-of-the-art computer at the bedside. So a lot of the stuff will be in the wall, attached to the wall. So I truly visualize that it's going to be one of those things that the nurses are going to say, oh my God, what took us so long to do this? So we're looking at bedside computer, the room are more spacious. They will be able to have more time spent with the patient because now they don't have to leave to look for anything because everything will be built in. That's the labor and delivery part. For the postpartum part, I see the same thing where the rooms are going to have all the necessity, but nothing on the floor. Everything is attached to the wall. The computers are there. So the nurses will have such a beautiful environment. Right now, we are a little bit vintage. So just having that beautiful new place will create a better atmosphere for them. And I think they're looking forward to it. So we're also looking forward to it too.
It's been a hard time during COVID for our nurses. They've been doing so much. They've been asked to do so much. As you know, they've been stretched thin because it's a big nursing market. They could work in many different places, but they've chosen to stay here at Phelps. And I can't help but think that these renovations are something that just must be another selling point for us to keep our great nurses here.
Absolutely. Yes. Thank you. Yes.
Great. Well, Dr. DiStefano, from a physician perspective, what do you see and what does your group see these renovations doing that are going to help patients? Like why would a patient want to come here? How is this going to benefit them for their medical care?
Well, Phelps has always been a great place to have a baby, as I can attest to, having had them there. By renovating the whole unit, we are in fact also going to upgrade our nursery. And I know I'm not supposed to be talking about this, but in Dr. Khalife's absence, the improvement in nursery care will allow us to even better manage earlier pregnancies, preterm births and complicated births. But what I see happening, as Eve pointed out, we will have an improvement in our OR space. We have 2 operating rooms built into the labor unit. We have that now, but they're tiny rooms. They were the original operating rooms dating back to the 50s when the hospital was built. So the rooms will be larger, but also the idea of building in all of the gases and the support instruments to relieve clutter. It's just going to be so much easier to move around the room in terms of safety. We also, Kathy didn't mention it, but Phelps being a family-friendly and yes, baby-friendly hospital, we really encourage labor support with family and doulas. So the increase in the size of the labor rooms with the maintenance of, yes, the tubs, I have to thank Kathy for bringing tubs to Phelps. And I'm laughing about the first tub she brought looked like Noah's Ark. It was a portable tub that we wheeled into the corner of a room. And we flooded the operating room downstairs from us more than once with opening the door of the tub. But the built-ins are wonderful, and I'm sure I agree with Kathy. I think that the new tubs will be every bit as beautiful as the ones we have. But there'll be more room in the room for not only the patient's partner, but a doula for support, other family members. You know, right now with the COVID restrictions on the number of people allowed on the unit, that's been, you know, very trying for everybody. We really encourage families to come and support the laboring woman. So that can be difficult when an emergency arises and there are a lot of people in the room in a tight space. So I envision the built-ins, all the technology remaining cutting edge and being able to grow as new things come along. I just think it'll be a smoother application of all that technology, and while encouraging a natural birth with minimal intervention if possible. And when we have to intervene, making that as tolerable as possible, if you will.
Thanks, Dr. Stefano. And, you know, one other thing that I was curious about, you know, when, you know, doctors are human, midwives are human, they have to go to the bathroom sometimes and take breaks. They go back to a call room, they have to return phone calls to patients. Tell me about how these call rooms are going to be safer for our patients when you're using them.
Okay. Yeah, that one of the exciting things about that's included in this renovation is we have telemetry monitoring. What does that mean? It's that monitor that's strapped to the mother's abdomen with a nice soft belt that picks up the baby's heart rate and also tells us about contractions. Now we have the wireless technology so that our laboring moms can walk freely around, and we still get the wireless transmission of that data. Well, those terminals, you know, they're basically flat screens that can receive that data, will be installed throughout the unit, not just in the labor and delivery area, but as you point out, in the on-call rooms, in the break room, in the postpartum area, because labor, obstetrics is absolutely a team sport. Everybody on the unit participates in patient care. So, I mean, we have a wonderful nursing team. We have lactation consultants. We have residents. We have obstetricians, midwives, all participating in patient care. We all look out for each other, and we all look out primarily for the patient. So having telemetry monitoring in a HIPAA compliant way, no names, just tracings, because honestly, we treat all people equally. It doesn't matter whose patient it is. When I'm, you know, if I look up and at the monitor and see what I perceive to be an issue with a baby going on, I will just go to that room to find out how I can help. So, you know, the telemetry monitors throughout the entire new unit is going to be, you know, very, very helpful. And I think a big plus for safety.
Yeah, what a great safety feature.
Yes.
You know, we've spoken a little bit about natural birth, and at Phelps, we've historically had C-section rates that have been lower, much lower than national averages. And I'd like to think, and you can opine as well, but I'd like to think it's because we have this wonderful collaborative approach where the doctors, the midwives, the staff are all working together, looking out for patient interests. I was wondering, Kathy, how do you think these renovations will continue to facilitate that natural birth? And maybe you can talk more about the whole concept of natural birth and why that's so important.
Sure. I mean, you're right. Phelps not only is below the national average for C-sections, but we have for many years running had the lowest C-section rate of any Westchester hospital. And that has brought a lot of patients to us. In fact, in my practice, we get people from actually far outside Phelps's usual catchment area, you know, down in the city and Connecticut, Rockland, Putnam. So people really look for our low C-section rate and our tubs and everything that we do to help facilitate what we call physiologic birth, you know, birth without too many interventions. But everybody knows that if we need an intervention, we'll jump right in and do it. We have everything we need, the people and the equipment to do it. So for natural birth, mostly what we need to do is support and not interfere. I tell my patients all the time, I am there to keep them safe and to give them support and to give them the space to do what it is that they need to do to feel most comfortable, as long as it's safe. And so we have very liberal policies at Phelps for what position somebody can get into, for instance. It really does help. And somebody needs to know more than anything else that they're safe, because labor doesn't go well if you don't feel safe. And so that's what we try to do. We really try to have an environment of safety and support. Those are the two main things.
Thank you. And so now that we understand what that natural birth is and how we, you know, what we're striving for, how do you feel like some of these renovations will help facilitate that?
I think that having the bigger rooms will be awesome so that they can move around more. We know that moving is what helps labor to go more quickly and makes people feel more comfortable. So, you know, back in the old days before the pandemic, we used to have people wandering through the halls a lot, going up and down the stairs just to keep moving. Now people are confined to their rooms. And so when they're in a small room, they don't have a lot of choices for how to move around. And so having a bigger room will be great. And the tubs, of course, which I've already talked about.
So
I think those are the main things.
Great, thanks, Kathy. I understand as part of these renovations, they've paid particular attention to a lot of little details, things that we might not consider so important, but can be, especially to a patient who's stressed or anxious.
Yeah.
So, for example, I understand with the new configuration of these operating rooms there for C-sections, there's even been thought to make the partner's life a little bit better, that there's some additional room for them to now change, you know, to go into the C-section. They can't just wear their street clothes. It's a different environment. Tell me about how that process is going to change and how this detail is going to make it a little bit better for people who are under the stressful situation of having to go for a C-section that they never wanted or hoped for.
Is that directed to me?
Oh, thank you, Dr. DiStefano. Yes, I meant to direct that to you.
Okay. Yes, one of the nice things built into this unit is going to be a changing area for the support person. We always invite the father, the support person, to come into the operating room for a C-section. We don't want to separate families. They should be there. In the case of an urgent need for a C-section, often the person is left kind of just standing in the room in dust, you know, and we whisk people away. Having the changing area, there's a dedicated room with a locker that they will be directed to that adjoins the C-section, the operating room. So they won't be separated from the laboring woman at all. You know, it's just a matter of time to change and then into the room, because it could be very frightening to be separated and not know what's going on and waiting for someone to come and fetch you, while you get changed. So I think that'll be an improvement. I think also the larger rooms will allow for more room for the family to be together. I mean, our goal, if we have to do a C-section, is to get the baby out. Our neonatology staff is on site and there for every C-section. Babies received immediately upon birth by C-section by the neonatologist, who evaluates the baby and supports, if any support is needed, supports the baby. But in the vast majority of cases, the baby is then fine and gets swaddled, and our goal is to not separate babies from their parents. So we hope to have the baby and the mom and father of the baby together in the C-section room and bonding as they would have if it had been a vaginal birth.
Yes.
And just one thing I wanted to clarify when we talk about natural birth, that doesn't necessarily mean a natural, no medication birth. And I'm sure Kathy will agree, we roll with it. We have all options available. We encourage and support an unmedicated birth if that's what a woman wants. But we also do have the availability of 24/7 anesthesia services for epidurals, which everyone knows epidurals are popular. We don't force them on people, and we also don't withhold them. And we do have that access. And I'm sure our anesthesiologist will also be happier with the larger rooms and the built-ins and all of that for ease of administration of an epidural. So.
You talked about built-in gases and that. Can you explain that concept for people? I mean, those are things that a layperson, I wouldn't necessarily be looking for in a room or notice or understand the importance. Could you talk through that and how that's a change?
Okay. Well, you never want to think about having to resuscitate somebody, but the truth is, labor, while it's wonderful, is also dangerous. So there are emergencies that arise. So when I talk about the gases, I'm talking mostly about oxygen in the labor rooms. And there has to be a portal for oxygen to be delivered to a patient in need. Also, we need suction because sometimes there's heavy bleeding or, and we need to be able to suction blood out of the way. I know it's not things that anyone wants to think about, but they're absolutely necessary in every room. Those come into the room through ports on the wall. Currently, they kind of stick out from the wall. When I say built-ins, I mean a panel where just the tube comes out of the wall, not a big canister or a bottle it's all flat against the wall, but we need those access to both of those things. In the operating rooms, there is still going to be an anesthesia machine with gases. And that type of gas is to put people to sleep, which we don't often do in the labor setting, but that would be that's a different type of gas machine, if you will. One other thing that is new in the postpartum unit that we're very happy about in terms of safety is that we now have in every postpartum room 2 sets of gases and suction, so that, again, God forbid, if we had to resuscitate a baby and a mom, we have separate units. So Phelps is a baby-friendly hospital. What does that mean? We don't separate mothers and their babies. Babies room in, they are with their parents for their entire stay in the hospital, in that room. Having the 2 sets of support ports is, I think, a major advantage, so that we don't have to whisk a baby to the nursery for any support. We can do it in the room.
Great, thank you. You touched on baby friendly, and we've mentioned that a few times. Eve, you have experience with baby friendly. Oh, before we go on, Dr. Khalife.
Yeah, hi, sorry.
Hi, Dr. Khalife.
Yay,
Welcome back.
it's
Sorry
wonderful
for
to see
joining
you.
late. I'm sorry. I was at caring for a baby now. So
Yes.
We forgive you for saving a baby's life. Thank you.
all right, thank you. Thank you.
We've been talking a lot about, I think there's a little bit of an echo, and I'm sorry, but we've been talking a lot about, what this has looked like from the perspective of the providers who are delivering the babies and treating the mothers mostly. We're going to shift a little bit to what it looks like for the baby as well. This is a mother-baby unit, and I want to focus some of our attention on the baby. To get there, first I want to talk about baby friendly. We've thrown that term around a few times, but it's a huge distinction. It's a big deal that Phelps has. It's not something that's granted easily. Eve, you've played a big role in this process. Could you explain exactly what this designation means and why it's so important to our patients?
Yes, baby friendly. Well, we received the first designation of baby friendly in 2016. It's good for 5 years, and what it means, it's like a whole idea of mother, father, baby. Everybody's together. We never separate them to the family unit. We provide the whole natural breastfeeding. Everything is done with the family involving in the care of that baby. So we just got recertified, and we just received 2 weeks ago that we passed, just like, I don't know if anybody know when Magnet comes or JACO comes, that's what we went through the whole process. So we were very, very happy to receive our second designation. And I just want to say that we were the first hospital in the whole Northwell to have it first. So we were very proud of that. So that being said, the whole concept of our baby friendly, everything we do with our patient is us taking care of the patient from a whole holistic approach of the whole family unit together, never separate them, providing them breastfeeding, breast care. When the baby is born, we put the baby to the breast right away. We don't separate them. We try to do skin to skin, which is something that we really, I have to say that that's something we do for pretty much, unless there's an issue, every delivery we try, even during the C-section, we try to do the same thing. So we were very proud to receive this redesignation. And I am sure that, as you know, having the midwives, and I think that the whole concept is involving that. The midwife really support that, the physicians support that. So the family members, there's some patient that comes in with some specific, they want specific things to be done their way. We always try to accommodate those family members as to what they want with their babies. So, and Kathy could tell you that I think that's one of the big draw we have. We are baby friendly. We try not to push any bottle feeding unless the parents want it. We always give the patient the choice of what they want to do. And Kathy can tell you more, I'm sure.
And Eve, that's a really helpful description. How do you see these renovations making us even more baby friendly or more compliant with that distinction?
Oh my God, you should see what the rooms will be looking, especially for postpartum. So in the postpartum floor, our goal is in the rooms, the patient will have everything that they need. They never have to leave the room. We have everything right there for them. So the rooms are set up in a way where we will have the breast pump, anything that has to do with breastfeeding. Everything will be in the room. The patient doesn't have to worry. That's there little area. They're home away from home for the time being. And we provide, we are hoping to provide refrigerator. That's one of the things that I have to try to see if I could talk to Jill about that. We want to give every patient a refrigerator in the room so that they can keep their breast milk, all their necessary stuff in there. So that is one of the, I'm looking forward to it because the rooms look like you are in a hotel. So, and that's what we want the patient to feel. They're home. They're not in a hospital setting.
Thanks, Eve. That's
Welcome.
great. So, to everybody out there listening, this is a big distinction. You'd want your loved ones to go to a baby-friendly hospital. It makes a big difference for these first few hours and days of life. Speaking of which, we haven't talked so much about the babies. And now that we have Dr. Khalife here, first, could you introduce yourself so everybody on this chat knows who you are?
Yeah, sure. Hi, everyone. I'm Mazen Khalife. I'm the chair of Department of Pediatrics at Phelps and the chief of neonatology and newborn medicine. Obviously, I work at Phelps, part of the Northwell team. I've been in the neonatology practice for, I guess I could say, for over 25 years now. So it's always a pleasure to me that to be in this field and helping babies and family to get better and bring the smile and happiness to the families.
Thank you.
Thank you.
So far we've talked about a patient's experience. So they come in, they see this beautiful place, they go into the L&D and they deliver their baby, they go to postpartum. One thing we haven't really talked about is this whole different area, which is a nursery. Can you explain after these renovations what this nursery is and how that's going to help these newborns?
I mean, it's as Eve was saying, it's nice to have a nice place and a hotel-like place and all of that, which is important to have the patient comfortable. But it's, in my opinion, as neonatologist, it's more important to have the ability to care for them and to provide the care they need if needed. And so we are ready for that. We have a team of neonatologists here from Northwell, providing immediate care for the baby when needed, because anytime there is something with the newborn baby as they deliver, a minute or two could make a big difference for their life, for long, and years to come, So it's important to provide that care immediately, and that's why we have it here at Phelps, and we have neonatology team to provide the care immediately. In addition to that, we wanted, some patients, they have risk factors, and at Phelps Hospital, designated by New York State as level 1, there are certain patients we cannot keep here when they are born and they have issues, so we have to transfer the baby. So we are working with the leadership at Phelps and Northwell to move to level 2 perinatal center, where we could keep mommy and baby together. We don't need to transfer them. And hopefully this will happen next year as we develop and build here our NICU, because there is certain criteria, facility criteria, medical criteria, all of that. So we almost have everything we need. Just we have to develop the facility, which in the plan, and we are moving forward with that. So it's important to keep mommy and baby together. We should not separate them, transfer the baby. It's important for bonding, successful breastfeeding, the support for the family, and the emotional well-being of the parents. That's all very important to have mommy, baby, and daddy together. In addition, studies have shown that when parents are next to their baby, when baby is not doing well, that the support and the bonding, when they're standing next to their baby, it's important, and they recover much faster, and that's a proven science, so it's important to have the whole family together.
Thank you. We've used the term NICU, and some people in the audience might not know that's neonatal ICU intensive care unit. Can you speak to really what kind of services now we can give to these kids when they're born, these babies?
Absolutely. Once we have the neonatal intensive care unit and the level 2 designation by New York State, will be able to care for premature babies, for example, which now they come here, we have to transfer them. It's inconvenient for the mother to go to a different provider, to a different hospital they are not familiar with. So it's important to keep them in the same system. So we will be able to care for the premature baby, for example. They are subject to certain conditions such as lung immaturity that they need respiratory support, such as nasal CPAP, ventilation, ventilator, surfactant therapy to help maturing the lung. All of that we have it here available. We provide it immediately when needed, but unfortunately with our designation now, we have to transfer them subsequently. So with having the designation level 2 and rebuilding the new unit, we'll be able to keep them here and care for them here. So one thing, about caring for the new premature babies, as I mentioned, mostly their respiratory status and lung immaturity, which usually it's a maturation process, will get better in time. It's just we have to support it until that maturation process is established. There are other conditions, babies, for example, like the risk factor for infection, so we'll take care of it and we treat the baby. There are nutritional aspects, we'll be able to care for them and provide it for those premature babies. So there are many aspects that will provide the service here and keep the family together, and maintain the bonding and the emotional well-being for everyone.
Yeah, I understand in one of those difficult scenarios where a baby has to be in our NICU, that we've even created with this new renovation, even a space for the parents to be there, so they get to actually be in the NICU with the baby and not be separated. Is that correct?
Absolutely. We have the way it's designed that we'll have enough room for the parents to be with the baby. We have also mother room right inside the new neonatal intensive care unit, and this will allow mommy to, for example, premature baby, so you cannot sometimes put them directly to breastfeed, so she'll express her milk and provide that milk to the baby, and they'll be very close to the baby. They'll see the progress and they'll be up to date with all the information immediately. So that's all very important to build the relation and the trust between the provider and the parents, in addition to have the parents close to their baby and see the progress and continue the bonding and all the, this all important for the emotional well-being, which will last for years to come. And I mean, this is not just because when they are separated and like that, and there are many studies have shown there is, like problem connecting and bonding. But when we have it all, the family together, it's important for the long term.
My oldest son had to be transferred from where he was born to a level 2 NICU, and it was so stressful. So it's wonderful that here at Phelps we'll be able to keep those families together during such a scary time.
Absolutely, yes.
Great. Well, we have unfortunately reached the end of our time. It's been really fun to hear about these renovations. It's great to hear what a wonderful facility that our unit currently is, and how much better it's even going to be an experience for our families going forward with these renovations. So, I want to thank everybody for being on this panel today and helping us understand all the special things that Phelps does for our patients in our community. And thank you for being on it. And Jill, I'd like to turn to you at this point.
Thank you so much, Dr. Gottlock. And Dr. Khalife, I'm glad you were able to join us. I also want to thank Dr. DiStefano, Kathy, and Eve for just a fabulous panel. And what really comes across is how well you all collaborate together. And you all said that in many ways. So when people choose Phelps, they know that they're going to be in the very best hands. So thank you so much for all that you do. So I'm Jill Sibilia. I'm the Vice President of Development here at Phelps. And again, I want to thank you for joining us tonight. The transformation underway in our maternal child health area is really, really exciting. And I hope you caught some of that excitement this evening. We'll bring more to you as the units continue to evolve and have the renovations. All of this is possible through a combination of capital investment from from Northwell, and also from generous philanthropic support of people like you who are supporting this project. And for that, we are very, very grateful. And now it's my pleasure to turn it over to Mary McDermott, who's our Senior Vice President of Patient Care Services and our Chief Nurse, who will close this evening's program. Mary?
Thank you, Jill. Hi, everyone. Wow, what an excellent panel. I think it was so informative, and as Jill said, so collaborative, and it really, you exude the enthusiasm and the professionalism of our maternal child health service. And the tour was so impressive. I think that the progress of our renovation project really has been amazing, and I hope that you enjoyed the tour as much as I did. So as Jill said, in closing, I just want to express our sincere gratitude to Ken Tabor and our entire Phelps Community Board for your leadership. All of our presenters tonight, Dr. Gottlock for moderating, Dr. DiStefano, Eve, Dr. Khalife, and Kathy. I think you imparted such wonderful information on this series. And I want to also thank all those who have generously supported our maternal child health area. Really important to be able to make this progress. Our maternal child health team, including our nursing leaders, our registered nurses, and certainly our nursing support staff, our nurse midwives, our physicians and providers, and all who collaborate expertly to provide such wonderful care. We hope you enjoyed this installment of our Insider series. And just want to tell you about our vision. So our vision at Phelps is to provide a patient-centric experience while delivering access to the most innovative treatments, breakthrough discoveries, an unrivaled network of specialists. We achieve this vision through investment in exceptional talent, technology, and facilities. And your generosity helps make these investments so very possible. So we really thank you. So I hope all of you have a wonderful evening, and thanks so much for joining us tonight. Thank you.
Thank you again, everybody. Good evening.